I graduated from Central Hardin High School in 2001, so I came up through GC Burkitt and East Hardin Middle School, if any of you all went to those schools, and kind of always had an interest in math primarily and also in science. So would that be something that's pretty familiar to you guys? You like math and science, a lot of you all in here? No, I see some no's back there. Well, that's okay too, because there's a lot of different opportunities that you can have going into the health sciences field. So the field that I kind of was drawn to a little bit more was pharmacy. Anybody know what pharmacy is? I know you guys probably talk about it. A lot of times when you think of pharmacy, you think of that's where I go to get my medicines, right? Like if I'm sick, I need to go to the pharmacy and get some medicine to take to help me feel better. And so that's kind of what my perception was of pharmacy. I knew that there was chemistry involved and those types of things, but besides that, I didn't really know a whole lot about what pharmacy was all about. And so what I did, and I would encourage you to do as well, is I talked to people in the community who were different healthcare professionals. I talked to doctors, I talked to nurses, kind of in that area where I knew I really just wanted to go and help people, and also could, really draw on some of those things that I enjoyed the most, some of those subjects from school where I really enjoyed those the most. And so I went and talked to some pharmacists, and actually while I was in high school, I went to a Rite Aid on Dixie Highway and I did some shadowing there and realized that it was something that I liked, being able to talk to patients that come in to get their medicines filled. A lot of times, probably what a lot of you are probably most familiar with is if you've got a cold or sinus infection and have to go to the pharmacy and get something. But there are some people that are on medicines as we get older, and even some younger people that have diabetes, for example, have to be on medications, and they have to pick those up every month. So I really liked being able to talk with patients and get to know them and make sure that their conditions or things that were wrong with them were being treated, and pharmacists can have a really big role there. So that's kind of what led me to pharmacy. And so my pathway, just for you guys, at the University of Kentucky College of Pharmacy, at the time that I went to school there, was looking at schools. They were one of the top pharmacy schools in the country. And so it was really nice because they were close to home. I'm from Elizabethtown, obviously, and so it wasn't too far away. It was a school within our state. And also it was ranked high in the nation. And at that time, it was actually the only pharmacy school that we had in the state. Now we've got Sullivan, which is even a little bit closer up in Louisville. And so I did my undergraduate studies. So I graduated from Central, and then I went on to the University of Kentucky. And also where you guys really, have a lot of good opportunities that I've learned about today from Hardin County schools and in your particular high schools is the ability to maybe get some of those college credits. So, I know it's probably not something that you're thinking of right now, but one of the biggest things that I hear from students, because I also teach now at the College of Pharmacy at UK, but a lot of times what I hear from students is about how much college costs them, right? And so you've got all these thousands of dollars in student loans for having to go to college and take these credits, and now they're having to pay those back, and they're thinking about paying those back when they start working. So if you have the advantage in high school to get some of those college credits, if that's what you're interested in doing and going to college, I would really encourage you to take advantage of getting some of that taken care of while you're still in high school, and so you won't have to worry about that. You'll have a little bit more opportunity maybe when you get to college to do some other things besides have to take so many classes, or if you're like me, I knew what I wanted to do, and so that was very helpful. So I actually was able with some credits from high school. So I took, when I was in high school, we had our AP classes, and so you could take the AP test and get some credits for college. So I was able to do that at least and get a lot of my college credits. So I was able to complete everything I needed to go into pharmacy school in just 2 years of college. And so I didn't have to go a full 4 years or even longer before I applied for pharmacy school. And so that's something that I would recommend if you guys have the chance to be able to do that. That was really helpful. And at the time, it may seem a little bit harder, right? Because you're taking these harder classes and you're having to study a little bit more. But I was still able to have fun. I had a lot of friends in high school. I was a cheerleader for the boys varsity cheerleading squad at Central Hardin. And so I got to do a lot of fun things. I was a class officer in a lot of clubs. And so still got to do a lot of fun things, but you just have to really manage your time and make your work your priority. And then you'll have time to do some of those other fun things as well. And so I went to 2 years, like I said, at UK for undergraduate studies, and then I was able to take the test to get into pharmacy school. It's called the PCAT, and able to apply my second year of college, and I was accepted into the College of Pharmacy. So the College of Pharmacy, now all of the pharmacy schools across the country, it's actually a doctorate program. So you will become a doctor once you graduate from pharmacy school, and UK was no different. And that's a 4-year program. So they're kind of changing the way their curriculum or the way that they teach students now. It's a lot more interactive, so probably some of what you guys are seeing. So we do a lot of the students will do some pre-work, and they're, on their, everybody has an iPad or a tablet that they're doing their quizzes or their works, and it's a lot more interactive, working with other students, kind of group projects and those types of things. But the last year of pharmacy school, and there are some opportunities throughout as well, it's where the students actually get to go into different pharmacy settings and practice. So there's no more really schoolwork. You have to take one more big test before you become a licensed pharmacist. Actually, 2 more. You have to take, it's called the NAPLEX, which is a big national pharmacy exam, and then there's a law exam for each state that you have to take that's pretty tough. But again, you kind of learn all of those things that you need to know to be successful in that exam throughout pharmacy school. But no more test or classroom work that last year, because you're actually on site getting to practice. And honestly, that's probably where I hear that most students learn the most, is when they're actually right there doing those things, right? So that's also another kind of take home. I would encourage you to try to get, go and practice, because you don't want to spend, 6 years, 8 years in school and go to professional school and then realize that you absolutely hate it. And I hate to say it, but there are some students that I have that have never worked in a pharmacy, and they come to my practice site for a rotation, and they realize that I don't know if I really like that. So I would encourage you, even now, before you get into it, maybe go and look at a pharmacy. Sometimes you have to be 18 to work in a pharmacy, but maybe at least talk to some pharmacists if you're interested, or nurses, or doctors. I understand that you guys have those that come in here to talk to you about some of the things that they do. So I graduated pharmacy school. I actually did a little bit more training. It's called a residency, so you might be familiar with that term. With doctors, they have to do some extra training before they can fully practice independently, and so that's what I did as a pharmacist. It was called a community pharmacy residency. So, kind of that picture that we painted of what your pharmacist is and what they do, if they fill your prescriptions for you when you're sick, there's a lot of other opportunities for what pharmacists can do as well. So there's pharmacists that work in the hospital. So if you've ever had to go to the hospital or have a family member that's been in the hospital, see those IV bags that they have, usually there's medications in those, and so pharmacists are the ones who prepare those and ensure that the patients are getting the right medicines that they need. There are opportunities to work with like insurance companies, opportunities to do like medical writing. If you may not like, the math and sciences, but maybe English is your thing or something, there's opportunities to do medical writing. There are things that I do as a pharmacist that I never really dreamed that I would be doing. But really where I focus right now is on diabetes care. So has anybody ever heard the term diabetes or know what it is? High blood sugar, right? When some of you might have family members, or some of you might have diabetes yourself, where you have to use insulin or take medicines for that. So diabetes is something that impacts a lot of the people that are in this country, and more specifically even in our state. And it was interesting, I was just sharing with the group earlier, what they found out now is that we can actually prevent diabetes for the most part. So the biggest type of diabetes is called type 2 diabetes, and so that's probably, if you know somebody or have a family member with diabetes, that's probably what they have. It's about 90 to 95% of the people that have diabetes have that type of diabetes. But we've recently learned through just some research that we can prevent that from happening if we put patients through some structured programs and provide education. Maybe even some medicines can help prevent it. And so that's a big part of what I do right now. I'm actually, like Mr. Wright said, I work at the College of Pharmacy, so I teach some there, but my main job is with Kroger Pharmacy. If you guys are familiar with Kroger, the grocery store, we've also got a pharmacy in there, and also some little clinics where nurses and nurse practitioners work to, you maybe have been there before, maybe to get a school physical or sports physical, or if you were sick, you might have run in there to get a prescription from them. But so we've got those in our Kroger stores, and we also have dietitians. So that's probably another one of those health sciences that you may work with as well. Actually, the person who kind of prepares and decides all of the foods that you guys have in Hardin County Schools is actually somebody that I graduated with, and she went to school to be a dietitian. So that's another important kind of health science area as well. And so we work together to help patients make healthier choices in the foods that they eat, help teach them how to do physical activity, so different exercises, so that they can have weight loss. And we know that's what can help prevent type 2 diabetes. And so that's been a big focus. And most recently, a group that you'll probably hear about at some point, you may have heard about them on the news or in some of your studies too, the Centers for Disease Control and Prevention, or the CDC, that's based out of Atlanta. You know, a lot of times we think of them when we think of like some type of big disease outbreak or something, and if you ever get a chance to go to their campus, they have some really, you know, unique things that they study there. But one of their focuses is to make sure that this diabetes prevention program gets to areas across the country that really need it. And of all of the areas in the country, Hardin County, Kentucky was actually identified as an underserved area. So we have a lot of people in Hardin County who are at risk for developing diabetes, but there really aren't a lot of good programs. And so that's one of the things, even though I don't live here anymore, I stayed in Lexington, Kentucky, where the university is. After I graduated, my husband, who's here and is a pharmacist as well, we stayed there after we graduated and practiced pharmacy in Lexington. But I was able to bring that program back here to Hardin County, and we really hope to help people that live in Hardin County. We hope to decrease that number of patients that have prediabetes and diabetes, and turn Hardin County around kind of to really be healthier and not have that chronic disease and truly make an impact here. So again, as a pharmacist, that's probably not something that you would think that you would really do, but I was interested in the area of diabetes when I did some of my school at UK, and whenever I did my residency training, I got to work in a diabetes clinic. So we got to work side by side with doctors, and a patient would come to see us, and we would look at what their numbers were or how the patient was doing, and we would decide what medication that they needed or if we need to change their medicine. So I got really interested in that area, and so then I went on to become something that's also kind of one of those health science field opportunities called a certified diabetes educator. And so that's some extra training, some extra tests that you can do. If you're interested in a specific field, there are opportunities to specialize in different areas as well. So that's what I chose to do with my pharmacy license, is kind of focus in that area. And then also some of what I do, I also help to manage some of the pharmacies. So there are several Kroger pharmacies throughout the state, and so I have a group of those pharmacies, which actually includes the stores here, the two pharmacies that are in Hardin County and Elizabethtown, and help make sure those pharmacies are running smoothly. So even some of the business side of it. So I never really thought I was that interested in business, and I took some business classes at Central and had a little bit of background there, but really in pharmacy, it's a company, it's a business a lot of times if you work in community pharmacy, so having to learn and know about the business side is also important as well. So that's kind of my story, how I got to where I am. Does anybody have any questions or questions about, health sciences in general? As, working at the College of Pharmacy, we're doing a lot more where we collaborate with other health professions. So, a lot of times the pharmacy students will be in groups with medical students or nursing students, and they're all working together to do different patient cases or opportunities, and even some of their tests are done in that. It's called a collaborative approach. That's what we think about when we think about healthcare, and we know that's important, is to really pull all of those healthcare professionals together so that a patient has like a healthcare team, and so it's not just these different healthcare professions working in silos, yet we're all kind of together working to most effectively manage patients and improve their health. And you'll probably see some more of these opportunities as you go to college and undergrad, but really it's great that you guys are starting to be exposed to these things, because you think about, sometimes, I know, at least I did, I'm like, okay, when am I ever going to use this in real life, right? Like, I'm learning all of this stuff. How is it going to be applied to what I do, or why do I need to know this? But I think by being on a path, you sometimes can tie that together to see, okay, this is why I need to know these things that they're teaching me. So college is a little bit different, and everybody has, I think, a different path that you can go on. So mine in particular actually went away to college. I know a lot of people choose to kind of stay local, and I think that's a good idea too, until you really know what you want to do. But I was fortunate enough that I really had a great idea as to what I wanted to do. And also fortunate to have a little bit of scholarship to be able, so I didn't have to have a lot of those student loans that we talked about to pay to go to college, at least for the first part. And so it's a big adjustment, because you go from, you're independent and those types of things, but most of the time you still probably live with your parents, right, or an adult. So, oftentimes when you go away to college, especially, now you're living with friends, and there's a lot more, going on, a lot of other things that seem a lot more fun than class oftentimes, and you don't have your mom maybe waking you up every morning. So just have to really be focused and know why you're there. I had some friends that maybe didn't realize that importance, and they were paying for it a little bit later on, didn't maybe make the best grades, but I think if you keep focused and realize that what's important, and again, kind of, you have to manage your time. You can still go and you can still have fun and do fun things, but I think, kind of keeping in mind your priorities and, kind of putting school first and making sure that you have that discipline. Reach out for help. There are resources that are available. A lot of times your teachers are willing to work with you, but you just have to make sure that you remember why you're there, and really put that focus on your studies and make sure that you're, completing those things. While your teachers work with you, sometimes too, they're not quite as, they're like, hey, you're an adult now, right? So they're not going to be maybe quite as lenient as maybe some of your high school teachers might be. So again, you just have to have self-motivation, which again, I think, it shows a lot that you guys are in this pathway and kind of already, a step above there, that you're already thinking about those things. So I think that shows a lot. You guys are probably all pretty motivated students. Volunteer work is a huge component as well. The college too, that's a big focus of what we're doing at the college, is students have, volunteer opportunities that are given to them and that they are also required to do. But with my focus in diabetes, also, I was really interested in being able to give back and help those in need. And the American Diabetes Association was a way that I found that I could really do that. And so was able to get involved with the American Diabetes Association very early on. They do a lot of fundraising for diabetes awareness, diabetes management, diabetes prevention, and even looking at finding a cure for diabetes, because we don't have a cure right now. And so we do a lot of big events, like we do a big walk every year, but like I said, I'm in Lexington, but there are opportunities here in this area as well to get involved. And that would be something that would be great. We have a lot of high school students that come out. We couldn't really put on our big events that we do without volunteers and people that come and help out. And so giving back is very important. And if you can give back in an area that you're passionate about, or even an area that you work in, that can be very rewarding for you, and it's very much appreciated. And that's when you can really start to make a difference in your communities and in the world, really. So of all the diseases, why did diabetes interest me? And that's a great question, because in pharmacy school and even before, you learn about a lot of different things. But I had a very good friend that I played soccer with when I was younger that had diabetes. And so, just seeing what she had to do, and she was actually one that had to use insulin. So she had the less common type of diabetes, and how she had to adjust her doses for, when we played soccer, and depending on what we were going to eat, was something that was always just really interesting to me. And a place where I saw that, I feel like, a doctor or pharmacist can really help people that have diabetes. And then when I did some of my classes in pharmacy school, it was something that was just very interesting to me. I liked learning about the medicines, and also the fact, especially with type 2 diabetes, the more common type, there's so much that patients can do to manage their diabetes and live a long, healthy life. So a lot of times when we hear about diabetes, we hear about the bad things that go along with it. People, may lose their leg, or have problems with their kidneys and have to go on dialysis. But what I learned was that if patients can manage their disease, and if I, as a pharmacist or a diabetes educator, can help them do that, then we can help prevent a lot of those complications. So a lot of other diseases like cancer or some of those other things, you can give medicines, but it's a little bit harder to really allow the patient to be in control to manage that. But with diabetes, they can. And so, if more people just had the knowledge of what to do, then they could, help prevent a lot of problems later on. So why did I want to be a pharmacist? That's also a great question. So all of the different health fields, why pharmacy? And I think really what piqued my interest was when I actually went and worked and shadowed in a pharmacy and talked to a pharmacist. And so just knowing that, I could see a patient, patients are going to come and get their medicines every single month for the most part. And so knowing that I could kind of be right there to have those interactions, I like working with people and being able to help others. And so I felt like that was a really good way for me to do that, plus kind of be in the medical field, which is where I was, interested with the math and the science background that, were kind of the subjects that I liked best in school. Felt like it really could tie all of that together really well. And so this is actually maybe a lesson to learn. So I always like to be able to help, mistakes that I've made, help others. So from a pharmacy school admissions perspective, like I had mentioned, I ended up going only to 2 years of undergrad before going into pharmacy school. And the deadline to take the test, the PCAT, the entrance test for pharmacy school, was approaching. And because I was still kind of like in early on in my college, learning that independence, I almost missed the deadline. And back then when I was in school, you had to actually US mail the application and do all of that. So anyway, I just wasn't as aware. I wasn't on top of things, I guess, probably as I should have been. And I just happened to overhear a couple of my new friends behind me in chemistry class talking about turning in their application materials for the PCAT. And I was like, is that due today? Oh my gosh. And so I had to run out of class as soon as it was over and try to figure out what I needed to do. So, a lot of times there are steps into getting into pharmacy school. Or other professional schools. College in general, I would really lean in on your counselors, your teachers to help you with that process. And my advice is really just try to stay on top of it. With these professional schools, like I said, there's oftentimes an entrance exam, and there are deadlines that you have to submit your application materials in by a certain date. Different schools are a little bit different. The College of Pharmacy, I know, for example, at UK now kind of has a rolling admission cycle. So if you're interested in a specific college or school, what I would really recommend is that you are aware and do your research and figure out what are those dates, what do I need to do beforehand, because usually it's a pretty competitive process too, especially when you start to get into different professional schools. And so typically the process consists of completing an entrance exam, and then there's usually an application that you have to fill out, probably some different essay questions that they'll ask for the different programs. Sometimes you have to have letters of recommendation. Oftentimes you do. So if you have a mentor or a teacher, be thinking of those things now so that you're not panicking at that time of like, who can I ask to write this letter of recommendation for me? So think of those people, have some of those in mind, because typically you need those as well. And then usually if you pass those stages, then typically you'll have an interview actually to get into professional school. So probably not quite as much of an interview process for getting into different undergraduate programs at this time, but definitely as you get into some of those grad schools or professional schools, usually that process, that next step is you have an interview. So again, going into those interviews, preparing, researching what questions they might ask, talking to other people maybe that are in those schools already to get their input. One of the things that I did before my interview for pharmacy school was, I really wanted to make sure that I was aware of any pertinent issues going on with pharmacy. So I had to do some research and talk to other pharmacy students and pharmacists that I knew, so that I could be well prepared for any question that they might ask. If you're interested in a college, go to their website and kind of read about them, know what they stand for, what their mission is, but then also what those requirements are. Talk to people too. So I know sometimes that's a little bit harder, because we've got so much social media and we've got so much access and internet that we can, and technology that we can look at. But talk to people that have been through the experience. I think that's a valuable resource and that we sometimes overlook to get their input or advice or ideas on what needs to be done. Where do we see the future of diabetes? And so if you look at some of the different numbers that are out there, the CDC usually puts out numbers. You see that number continuing to grow, and they have these projections that, like 1 in 2 adults will have diabetes in the next 20 years or something like that. So it's projected, the growth of diabetes is projected to be really high. So the good news is, though, and I don't know that we'll see that because we do have these programs and there is such a push for that prevention. So basically, if you guys are numbers people, basically people that go through that program that I talked about have a 60% lower risk, basically risk reduction of going on to develop type 2 diabetes. So, we can cut that number in half, over half, if patients will be involved. So that's what, some of the work that I'm trying to do and that encouraging you guys to do as you practice. If diabetes is the area that you find that you could really make a difference or that you're passionate about, there's a lot that healthcare providers can do to help kind of change that trajectory, that it's not going to shoot up like we're anticipating if we continue to go at the same rate. But if we have these interventions and we can do this prevention and have additional research out there and more programs, I feel like we can decrease that pretty significantly. I'm talking a lot about type 2 diabetes because it's more common and what we see most of, but certainly, looking at research, and that's a lot of the research that the ADA that we talked about earlier, the American Diabetes Association, is doing to look at how we can prevent type 1 diabetes. So it used to be, if you have type 1 diabetes, you just have type 1 diabetes. You'll have to use insulin for the rest of your life. But now what we're finding out is that there are other therapies, and there's maybe even ways that we can prevent it and even cure type 1 diabetes. So there's been a lot of research. I work with a lot of people, like Ms. Wright said, nationally and internationally from other countries that are doing these big studies to look at how can we cure diabetes. So that's, a lot of what we're doing, a lot of those, different volunteer opportunities for those organizations. What they're doing, they're raising money to fund that research and to support physicians and different healthcare professionals who are looking at ways to do that. So we're definitely looking at that as well. And there are a lot of big researchers out there that I think we're getting closer and closer every day.